If your doctor recently told you your blood pressure looks perfect and you walked out of that appointment feeling relieved, I need you to stay with me for the next few minutes before you take that word at face value. Because for many adults over 65, the word perfect can be dangerously misleading. And by the end of this video, you are going to understand something most routine appointments never have enough time to explain. The safest blood pressure for an older adult is not always the lowest number on the page. In fact, for some people, a number that looks excellent sitting in a clinic chair can become a completely different story the moment they stand up in the kitchen, get out of bed at 3 o'clock in the morning, or walk to the bathroom half awake. I'm Dr. Vance, and today I want to show you the new truth about blood pressure in older adults. Not the simplified version, not the one-line pamphlet version, the real version, the one that takes your age, your symptoms, your medications, your fall risk, and your day-to-day function into account. Before we go any further, drop your age in the comments right now, just your age. And if you have ever felt dizzy, lightheaded, weak, foggy, or unsteady when you stand up from a chair or get out of bed, add the word dizzy, because what I'm about to explain lands very differently at 66, 76, and 86. And if you've ever had that brief darkening of the room when you stand, I want you to pay especially close attention. Let me tell you about a woman I'll call Helen. Helen was 78, sharp memory, independent, still drove herself, still handled her own groceries, still met friends every week. She had high blood pressure for years, and like millions of older adults, she did exactly what she was told. One medication became two became 3. The target stayed the same every time. Lower, lower, lower. Eventually, her readings started to look beautiful on paper. Her top number was in the low 120s. Her chart said well controlled. Her family thought everything was fine. But Helen started mentioning something else. She said she sometimes felt strange when she stood up. Not every time, just enough to notice. A little wave of dizziness, a little weakness, a need to grab the counter for a second. She mentioned it. It was brushed off. Drink more water. Rise slowly. You're getting older. Then one morning after breakfast, she stood up from the table, took 2 steps, and the floor came up faster than she expected. She caught herself badly, injured her wrist, and lost far more than her balance that day. What shook her most wasn't the pain, it was the fear. She stopped moving normally around her own home. She became cautious in every room. Her world got smaller. And that is the part nobody tells you about perfect blood pressure. Sometimes the problem is not the number while you are sitting still. The problem is what happens to that number when your body has to adapt in real life. If that sounds familiar, comment dizzy right now. Because the risk I'm talking about is not rare, and too many older adults think it's just part of aging, when it may actually be a blood pressure clue. Now here is where most people have been taught an incomplete message. For years, the public message has been very simple. Lower blood pressure is better. And in many cases, lowering high blood pressure absolutely does reduce the risk of heart attack, stroke, heart failure, and death. That part is true. A major NIH-supported study called SPRINT found that targeting a systolic blood pressure below 120 reduced cardiovascular events in selected adults age 50 and older. Another major trial, STEP, also found better cardiovascular outcomes with more intensive blood pressure control in older patients. NHLBI, PubMed. But here's the part the headlines did not explain clearly enough. Those studies do not mean every older adult should be pushed toward the same number, no matter what. SPRINT excluded people with diabetes and prior stroke. STEP showed benefit too, but intensive treatment also led to more hypotension. And geriatric cardiovascular reviews have repeatedly warned against a one-size-fits-all approach in older and frail adults. NHLBI, PubMed, AHA, journals. So no, the lesson is not, high blood pressure is good. That would be wrong. The lesson is this. The safest blood pressure is the lowest pressure that protects your heart and brain without making you dizzy, weak, over-medicated, or prone to falling. And I am not going to give you the practical target framework just yet, because if I give you a number too early, some of you will write it down, skip the rest of this video, and miss the part that actually keeps that number safe. Without the context, a number can mislead you. You need to understand why your body at 75 is not the same as your body at 45. 3 things change as we age that make blood pressure treatment more complicated. First, your arteries get stiffer. Younger arteries absorb pressure more smoothly. Older arteries don't flex the same way. That means the circulation your brain depends on is less forgiving, especially when you change position. This age-related vascular stiffness is one reason isolated systolic hypertension becomes so common in older adults. National Institute on Aging. Second, the body's rapid pressure sensors become less responsive. When a younger person stands up, the body usually adjusts quickly quickly to keep blood flowing to the brain. In an older adult, that response can be slower. So if the baseline pressure is pushed too low, or the medications hit too hard, there may be a moment when the brain simply does not get enough blood fast enough. That is the lightheadedness. That is the dimming vision. That is the sudden need to steady yourself against a wall. Third, older adults often handle medications differently than they used to. Kidney function changes, liver processing changes, medication combinations change. The more medications someone takes, the more fall risk can rise, especially if dizziness is already present. The National Institute on Aging specifically notes that some medicines can increase fall risk because they cause dizziness or confusion, and that blood pressure drops on standing are a known fall factor in older adults. National Institute on Aging. So when somebody says, "My blood pressure is 122/74, so I'm safe," my next question is very simple. Safe when? Safe sitting down? Or safe when you stand up, turn around, walk to the bathroom in the dark, bend over to pick something up, and your body has to keep your brain perfused in real time? That is the question too many people are never asked. Here's what I want you to do if it is safe for you to do it. Not to diagnose yourself, not to change your medication on your own, but to gather information your next appointment actually needs. Take your blood pressure monitor, lie down and rest quietly for 5 full minutes. Check your blood pressure and pulse while lying down. Write it down. Then stand up carefully. Check again once you are standing and again within 3 minutes. If you feel unsafe doing this alone, don't do it alone. Many clinicians define orthostatic hypotension as a drop of 20 points or more in systolic pressure, or 10 points or more in diastolic pressure, within 3 minutes of standing. The bedside method commonly used is 5 minutes lying down, then recheck at 3 minutes standing. American Family Physician. If you have a big drop, or you become clearly dizzy, shaky, faint, or dim-visioned, that matters. That is not nothing. That is data. Bring it to your doctor. And if you are going to check that tonight, comment test. Now, before I give you the safest practical framework, I want to say something directly. This channel exists for one reason. Older adults deserve the full explanation, not the rushed version. They deserve to understand what the number means in the context of their actual body, not just a textbook ideal. So if this video gives you clarity you haven't gotten in a short appointment, subscribe to the channel and like this video. Every subscription tells the platform that older adults deserve more than oversimplified medical advice. And every share increases the chance that someone else has this conversation before a fall, a fainting spell, or an avoidable medication problem. Now let's get to the question you came here for. What is the safest blood pressure for older adults? The most honest answer is this. There is no one safest number for every older adult. There is a safest range, and that range depends on how robust or frail you are, whether you have symptoms on standing, how many medications you take, what other conditions you have, and how your body tolerates treatment. If you are in your mid-60s to early 70s, generally active, independent, and not having dizziness or standing symptoms, many clinicians still aim for blood pressure under 130/80 if it is tolerated well. That can be appropriate for a healthy older adult, but tolerated well is doing a lot of work in that sentence. If getting there means fatigue, dizziness, near falls, or a major standing drop, then that good number may not be good for you. If you are older, especially over 75, or you are on multiple medications, or you have symptoms when you stand, or you are dealing with frailty, the safest blood pressure is often not the most aggressive one. In these patients, many experts focus on a more individualized range, often in the 130s systolic, sometimes low 140s, depending on symptoms, function, and risk. Geriatric hypertension reviews emphasize tailoring by functional status, and in more frail patients, an on-treatment systolic in the 130 to 150 range may be a reasonable safety zone rather than chasing very low targets. AHA journals. If you are over 80, or you have a history of falls, or you are clearly frail, or you feel worse the lower your pressure goes, then preventing dizziness, syncope, kidney stress, medication side effects, and falls may matter just as much as reducing long-term cardiovascular risk. In that setting, the safest treatment plan is often the one that keeps you steady, functional, and mentally clear, not the one that wins a contest for the lowest number. And there is one more piece almost nobody talks enough about, the bottom number. If your diastolic pressure keeps dropping too low, especially around 60 or below, that deserves attention too. Some older adults end up with a systolic number everyone celebrates, while the diastolic quietly drifts too low. That combination can be a warning sign that your circulation may not be as well supported as the chart suggests. Let me make this even more practical. Imagine two people walk into a clinic with the exact same reading, 136/78. The first person is 68, active, no dizziness, still exercising, not frail, and doing well on the current plan. That reading may be perfectly reasonable, and depending on the bigger picture, some doctors may discuss getting it a bit lower lower if it can be done smoothly and safely. The second person is 81, on 4 blood pressure medications, wakes up foggy, feels unsteady on standing, and already had 1 fall this year. For that person, the question is not, how do we force this lower? The question is, are we overtreating? Are we measuring standing pressure? Are we making the patient safer, or just making the chart prettier? Same number, completely different decision. That is the new truth. The safest blood pressure for an older adult is not a universal number. It is the number that balances protection with perfusion, prevention with stability, and longevity with quality of life. So what should you say to your doctor? Bring a home blood pressure log. Morning and evening readings for 1 to 2 weeks. Bring your standing and lying readings if you check them safely. Bring a symptom list. Dizziness, fatigue, morning brain fog, weakness, near falls, dim vision on standing, and ask this exact question. Given my age, my symptoms, my medications, and my fall risk, what blood pressure target is safest for me? Not what target is standard, not what target is ideal in general, what target is safest for me? That question changes the conversation. Because the truth is, the best clinicians are not treating a chart, they are treating a human being. And human beings age differently. Some older adults benefit from tighter control. Some older adults need a little more room. Some older adults are not undertreated. They are overtreated and don't know it yet. And if nobody checks blood pressure lying down and standing up, that part of the story can stay hidden until the first fall. The National Institute on Aging advises older adults to stand up slowly, recognizes that blood pressure drops on standing can contribute to falls, and notes that medication side effects such as dizziness can increase fall risk. The CDC's Steady Fall Prevention materials also include orthostatic blood pressure assessment as part of evaluating older adults for fall risk. National Institute on Aging (CDC). That is why this matters. Not just for numbers, for independence, for confidence, for staying able to drive yourself, for getting through the night without feeling like the room tilts, for staying out of the emergency room, for keeping your life bigger than the distance between your bed and your couch. So here's the bottom line. If you are an older adult, stop asking only, is my blood pressure low enough? Start asking, is my blood pressure safe for my body, my age, my medications, and the way I actually live? That is the real question. That is the question that protects you. And that is the question too many people are still not being told to ask. If this gave you a clearer framework than you had before, subscribe right now, like this video, and share it with someone over 65 who takes blood pressure medication. That share may start a conversation that prevents a fall, catches a hidden standing drop, or helps someone realize that perfect on paper is not always perfect in real life. I'm Dr. Marcus Vance, and if you remember one thing from this video, let it be this. The safest blood pressure for older adults is not the lowest number you can achieve. It is the lowest number you can tolerate safely while staying steady, clear-headed, and fully functional. Know your real number, and make sure the person treating it knows the real you.